Again, welcome everybody. My name's Stuart Kinner. I'm the head of the Justice Health Unit at the University of Melbourne and the Justice Health Group at the Murdoch Children's Research Institute in Melbourne, Australia. My co-facilitator for this webinar is Lindsay Pearce, who's a research fellow in the Justice Health Unit at the University of Melbourne. I want to start, as we do traditionally in Australia, by acknowledging the traditional owners of the land that we're meeting on. Where I am at the moment in Melbourne is on the land of the Bunurong people. They're one of 5 groups of people or tribes in the Kulin Nation in this part of Australia. And we always pay respect to their elders, past, present and emerging. This is particularly relevant, obviously, in the Australian context where Indigenous people are so dramatically over-incarcerated compared with non-Indigenous people. I want to acknowledge our funders for this webinar series. The series is supported by the Justice Health Unit, but also with support from the Centre for Health Equity at the University of Melbourne, and we're grateful for their assistance. This series of webinars was organised by Louise Sutherland in the Justice Health Unit, who's here tonight, but whose face is hidden because she's not presenting on this particular occasion. And the series is also developed with support from Claire Keane, Lindsay Pearce, who's co-facilitating, Elena Basey and Claire Chiminello. So thanks to all of those people for all of their hard work. Thanks also to T. Hin, who's our tech support tonight, and to Lily May, who's also provided some technical support for this series. So the aim of this webinar series is to understand policy and operational responses to COVID-19 in places of detention so far. And to identify in the views of our experts who present what have been some of the things that have been missing, what are some of the things that we've learned that we want to change about our responses going forward with a view to being sustainable. And from that, our hope is that we can start to develop some recommendations for comprehensive, sustainable and cross-governmental responses to COVID-19 in places of detention. So that's our grand aspiration. We've been thrilled to have some fantastic speakers. You can see there on the screen the 6 webinars. We've had 2 so far. The third webinar, the one for tonight, is focusing on rights, accountability, information and standards. And what do we mean by that? Well, I think I'll leave it to our 3 fantastic speakers to flesh that out. You're not here to hear from me, you're here to hear from them. So with no further ado, I want to quickly introduce our 3 speakers and then hand over to each of them in turn to present for a short while. Following those 3 short presentations, we'll open up to Q&A and I'll hand over to Lindsay to facilitate that Q&A session. So our first speaker is Tríona Lenihan, who's the Policy and International Advocacy Manager from Penal Reform International. Our second speaker is Dr. Ruth Gray, who wears multiple hats. Ruth is the Clinical Lead in Prison Dentistry for Northern Ireland, the Clinical Lead in Quality Improvement for the South Eastern Health and Social Care Trust, and also the Clinical Educator and Prison Network Lead for Project ECHO, which she'll speak about today. And our third speaker, also wearing multiple hats, is Commissioner Peter Severin. Peter is the Commissioner for Corrective Services in New South Wales in Australia, which accounts for about 1/3 of our national prison population, so a very significant correctional service in the Australian context. Peter is also currently the President of the International Corrections and Prisons Association, and so Peter's going to be speaking both in terms of the jurisdiction that he's responsible for, but also providing some international perspective through his role in ICPA. So that's our program for today. And with no further ado then, I'll hand over to our first speaker, Tríona Lenihan. Over to you.
Thank you, Stuart. Remembering to unmute myself for the first time. Thanks for the introductions and also for having me on the webinar today. I'm delighted to share our learning with you on these important issues and also to hear from the other speakers about their work. For anyone that doesn't know, Penal Reform International is an independent NGO working globally for fair and effective criminal justice systems. And we do that through practical human rights programs and also our policy program. My background is in law, particularly human rights law and public policy, and I've worked with various NGOs supporting law and policy reform in relation to criminal justice and also child protection. I've actually worked with PRI 6 or 7 years ago, but just very recently rejoined the policy team and was delighted to work on our briefing on coronavirus, which was published in July, and I'll share our findings with you today. So I think Stuart is able to share a link to the briefing, and I'll give you a bit of background on it. So 4 months after the pandemic was declared, we looked at key trends and human rights concerns in prisons and criminal justice systems. And the briefing includes recommendations for both urgent and systemic reforms to prevent harm now and in the longer term. One key issue we found is the significant impact of the ongoing restricted regimes that have been implemented in prisons in some countries for over 5 months now, on the rights and health of people in prison, particularly around their mental health. So we found that lockdowns, quarantines, and isolation measures have, at the very least, made time in prison much harsher and more burdensome, and in many cases have violated human rights. Nearly all prison systems have or did at some point cut off in-person visits, and in many places that included even legal representatives and monitoring bodies from visiting places of detention, although not in all countries. And we did also see some positive measures put in place to mitigate the impact of visitation bans. Some prisons lifted restrictions on telephone calls, made video calling available, such as in Kazakhstan. And in Kazakhstan, they also set up a call center where relatives, lawyers, and members of monitoring bodies could contact people in detention. In Italy, smartphones were disseminated as well, for example, to maintain remote contact. So these kind of positive measures should definitely be maintained in the longer term. And they provide an opportunity to supplement rather than replace visitation, especially for people with children, or to support rehabilitation and reintegration. But unfortunately, they're not available in every country. In some places, they've been very slow to implement, like in the UK and in the US. We're now hearing that free phone calls are starting to be rolled back, despite visitation still being less frequent than it was before the pandemic. As well as restrictions on external contact, many responses to the pandemic have involved some form of extreme restriction of movement within facilities. And this has meant that, for example, rehabilitation and support programs have been suspended or restricted in most places. And in many cases, people have spent 23 hours or more in their cells every day for months now. And that is, in effect, solitary confinement. The UN Nelson Mandela rules on the treatment of prisoners define solitary confinement as the confinement of prisoners for 22 hours or more a day without meaningful human contact. And the rules say it can only be imposed in exceptional cases as a last resort for as short a time as possible. Importantly, prolonged solitary confinement, which is this type of regime in excess of 15 consecutive days, is found to amount to torture or other ill treatment and is entirely prohibited by the rules. So the international evidence is that 14 days in solitary confinement does permanent mental health damage. But during the coronavirus pandemic, for example, in the UK, 2/3 of the prison population was essentially in solitary confinement for over 3 months. And that includes young people as well. In federal institutions in some provinces in Canada, people were in cells for 24 hours a day. And when they were allowed out for 20 minutes a day, they had to decide between calling a family member, their lawyer, or having a shower. And these restrictions are really important as we look to the short and mid-term future, because the combination of this level of isolation and lack of in-person visits with delayed court processes or probation hearings and high levels of stress and anxiety among the prison population and related violence that we're seeing in prisons all contributes to a mental health crisis in prisons, where people already experienced disproportionately high rates of poor mental health. So our recommendations in the briefing called on authorities to ensure that any restrictions to prison regimes and contact with the outside world should be proportionate to the risk, should be imposed for the shortest time possible, and be reviewed regularly by healthcare staff against evidence-based clinical COVID-19 guidelines. One area we found really lacking in responses to the pandemic is the lack of data and testing in places of detention. And that's both for people in prison and staff, which really leaves us with no clear picture on the human costs of the virus in prisons right now. We know from a live global map that's being maintained by Justice Project Pakistan on their website. And again, I think Stuart might be able to share the link to the map with you. Here we can see that over 200,000 people have contracted the virus in prisons in over 100 countries, and over 2,200 people have died in almost 40 countries due to COVID-19. But this is only what we know about, and in reality the numbers will be much higher. But we lack reliable data because of either limited or no testing in places of detention, and also a lack of transparency on testing and infection or death rates in some countries. So for example, civil society organizations in Brazil and Mexico have questioned the accuracy of official figures of people in prison infected with COVID-19. Figures are effectively a state secret in countries like Cameroon and Syria, where authorities have not provided any information. And journalists have even been fined in the Ivory Coast for disseminating false information when they reported on cases in Abidjan prison. The lack of data on the impact of COVID-19 on staff as well, on prison, police and probation staff, is also a major concern. And it reflects the fact that in many countries they're not considered frontline or essential workers, despite the risks that they face every day in their jobs. And in many places, testing has been done in their places of work after an outbreak as a response, rather than used as a preventive measure. So in terms of priorities going forward, one immediate priority is to reduce prison populations. And we must remember that before the pandemic, prisons were already in crisis. We have now over 11 million people globally imprisoned, which is the highest figure ever. Over 100 countries are operating overcrowded prison systems, which are generally underfunded and particularly struggle to provide adequate healthcare and mental health care. So the coronavirus pandemic has exposed the existing crisis in prisons. In some places, prisons were unable to provide any additional equipment, even soap, and in some, even access to water is an issue. So this means that in most places, the only viable solution in the immediate future to protect the health and lives of people in detention is to reduce the population. A lot of releases were announced initially, but less than 6% of the global prison population has actually been released, which is a lot less than was indicated and not near enough to ease the burden on prisons and ensure the rights and safety of the people both living there and working in them. Our briefing details some of the reasons why many of the political commitments didn't materialize, which I won't go into now because I'm running out of time. And in addition to the release mechanisms, I think another priority for us is for governments to look at who they're putting in prison and why, prioritize sentencing reform and decriminalization, for example, of petty offences, so that only those who really need to be are detained, particularly at this time. And finally, where they didn't already exist, emergency response and preparedness plans need to be put in place for this type of emergency and also natural disasters. And we urgently need plans for dealing with the consequences of the COVID measures that I've discussed to mitigate the severe impact on mental health. So I'll leave it there for now, and I'll look forward to your questions.
Thanks very much, Tríona. And we will provide links to both of those resources that you mentioned in the presentation when we upload this to YouTube and to our Justice Health Unit webpage. So anyone who wants to follow up on that can follow the links from there. We will no doubt come back to some of the points you've raised in the conversation later. One of the things that you mentioned that I think has been a recurring theme in this webinar series is the idea of the pandemic as a pressure test. And I think you used the phrase as expose the existing crisis. And certainly, in multiple ways, it appears that the pandemic is pressure testing our systems and identifying areas where there's a need for reform and investment and improvement. So with no further delay, I'll then move on to our second speaker for tonight, who is Dr. Ruth Gray, who, as you know, is wearing multiple hats. And Ruth, over to you.
Thank you very much. Thank you for this opportunity to participate today. I've met Stuart before at the WHO HIP committee, but this is my first connection with Lindsay, Louise, Claire and the team, and I really appreciate the support of this vital work. My presentation is structured around the questions posed by the team, and I wanted to take the global issues and apply them to a local setting, which in my case is being part of the team providing healthcare in prison in Northern Ireland. And I have to say, Tríona, it's like we're a double act, because so much of what Tríona has highlighted there is going to come out in what I've reflected on. Next slide, Stuart. Next slide, thanks. The main issue of COVID-19 in detention settings, I think, was the pace of change required from all organisations involved. An understanding of the disease trajectory became more evident, and predictions and disease modelling were conducted, but guidance was changing daily from multiple sources. I believe we were unfortunate to have such clear guidance from my WHO colleagues who published as early as the 15th of March. And this was accompanied by many critical documents from organisations such as Public Health England, Health and Justice, the documentation that Tríona's just mentioned, and national directives. It was difficult to assimilate all the changing guidance and equip teams to be prepared and responsive, and it was almost burnout before we begun. Another issue, as previously discussed, the epidemiological understanding of the incidence of COVID in prisons is difficult. In Northern Ireland, there was a recognition that prison was a closed population, and agreement to test every new person entering prison since April. The tests are conducted within 24 hours of entry by nurses, the dental team, or AHPs, and over 1,000 people have been tested with a 2% refusal rate. We were discussing this practice at the Five Nations meeting this week, and it was acknowledged that using healthcare teams working in prison to conduct tests may have an advantage with compliance. I'm going to go on and talk about the rights in the later slide. So next slide, Stuart. I think there's been issues, but there's been real opportunities as well with COVID, and one of the key ones has been collaboration. The Five Nations Health and Justice Collaborative between the 4 UK countries and Ireland has provided major peer support, enabling sharing of the latest guidance and contextualising it to the prison environment. The weekly calls also provided accountability and camaraderie for senior decision makers in difficult roles. And at a local level, there's been collaboration between the Northern Ireland Prison Service, the Public Health Agency and South Eastern Trust. And that has enabled the adaptation of the evolving guidance to a local context, and much work has been done on joint operational strategies for infection control, because we really have to work together. Another opportunity, and Tríona's already mentioned this, has been reduction in the prison population, which has been both aspirational and controversial across the world, with a small number of jurisdictions making bold political decisions and enabling action. In Northern Ireland, the Justice Minister acted quickly, decisively and preemptively. And over the last months, there have been people released under strict criteria within 3 months of their sentence end. With a prison population of approximately 1,500, 220 people have been released, which is 14% of the population. I don't have time to go into that more, but I think that's a real issue for all of us. Another opportunity has been around the prisons being closed to visits. So the Northern Ireland Prison Service, in response to the lack of access to family, quickly developed their virtual visiting model, and by May and June had enabled 4,500 visits. The feedback they received was positive, and that people felt more connected with being able to see their homes, their families, and even their dogs. People with families across the world could have visits for the first time since incarceration. And I really want to commend the prison service in Northern Ireland for responding so quickly, because that need is essential. Next slide. In March, following guidance, people have been isolated for 14 days on entering prison. And we are already aware from literature that the time of committal into prison is difficult and for many high risk. As a team, we had concerns about the impact of this time in isolation. So we adopted a regional survey previously used in our prisons to capture people's experiences of isolation and their expectation of what mattered most. To date, we've conducted 127 in-depth interviews. The issues that mattered most was connection, firstly with families in this uncertain time. The significance of a phone call or a virtual visit is critical. Staff attitudes also made a difference for those in isolation. If people were acknowledged and if they experienced kindness, that they really felt they could cope with this 14 days. The culture of prison is key to rights and compassion. Communication was second on the list of priorities. Understanding the altered regime, even for people who've been into prison many times, it felt like a new regime. And they needed to know what to expect and how to access support. The physical conditions were tough, and this was cited many times. How enclosed space, lack of movement, noise, lack of autonomy, increased people's anxieties and proliferated mental health problems. Healthcare services were also challenged about symptom support for withdrawal from substances whilst in isolation, and also encouraged to set up clear referral pathways for mental health and other services. Next slide. COVID-19 required a very medical model response to healthcare in prison. But on reflection, we quickly realised the wider determinants of health that would impact on people's well-being. And this required a response of connection and engagement. It involved distributing distraction packs and activities with cohorted groups, with bingo isolation being one of the favourites, where people used their call bells in the isolation unit to play the game. There was lots of collaboration with the prison safety and support team to develop a supportive environment for those who were in isolation. And information was key, and we quickly developed a newsletter for each site with the focus of contribution of those in prison. We've conducted thematic analysis of the in-depth interviews against time for major issues such as experience of healthcare support or access to phones or showers. These run charts enable us to evidence how we are doing in supporting people and to keep our services accountable. And I really take that challenge that Tríona has given us about the importance of healthcare reviewing those conditions and checking our own practices as well. Next slide. So what's been missing? Previous quality improvement work conducted in the prison looked at the information transfer at time of committal. It turned out for us it was the wrong place, wrong time, wrong medium. And in response, we had introduced healthcare navigators with a role to welcome people as they entered prison. So someone who was already in prison welcomed everyone on their first day and answered queries and explained what healthcare services were available. As COVID restricted movement, the peer mentor role was postponed. And this is a missed opportunity, as mentors are critical to the connection of supporting people, and they can help as well with public health campaigns such as COVID testing uptake. Another issue would be the transitional support for people moving out of prison into lockdown, and this needs to be mapped and developed. It's important to have systems in place to enable discharge with medication supply and with good information. There needs to be a pathway for public health tracking, if possible, positive with COVID on the time of release. And that reminds me of the long-term mantra of PHE Eamon O'Meara's that prison health is public health, and we need to connect our services. Tied into this is the need for transitional support. The exit from prison is even more complex for people entering a new world order of lockdown and social distancing. And we need referral pathways to health, housing and community services, and they really need to be developed. Next slide. So we were asked what the priorities would be in the next few years. For me, one of the keys is to learn from COVID. What has worked, what hasn't. It's an opportunity to reflect and then to prepare for Surge 2, to prepare for other pandemics. The changes that have occurred in the prisons in Northern Ireland have been incorporated into our South Eastern Trust learning framework. And we're looking at key themes in organisational learning and also specific areas such as testing, virtual consultations and redeployment, and trying to understand how we can improve what we've done. A second priority for us would be the development of a transitional service, looking to good practice in other places such as the States. With the use of Project ECHO, we plan to create a community of practice of key stakeholders to start conversations and process map pathways. The ECHO network will be founded on the all teach, all learn principle, with people who have lived experience in prison key to the design. And then I think thirdly, we would like to build up networks of peer mentors in prisons to support the community. These mentors will be trained, supervised and supported to gain transferable skills, but most importantly, given creative space to influence healthcare in prisons. Finally, the longer term priorities, and I think we've got to dream big. We have to hope and advocate for societal and legislative change in sentencing, decarceration and diversion of people away from prison. COVID has exposed what we already know of the importance of epidemiological data. We have to be ambitious with our public health approach in prisons to set up performance and information systems to be able to assess needs and outcome data, to introduce real-time data, responsive reporting mechanisms, and organisational learning systems. Finally, the COVID pandemic's impact in prisons has confirmed my resolve that we need to adopt a community development approach to population health and shift away from a pure medical model to enable agency of both frontline staff and the prison population, to challenge cultural norms and move towards a trauma-informed practice and co-design of services with people who have lived experience. We have to apply the wider determinants of health and bring creativity into our service delivery. Next slide. So in Northern Ireland, we've had a collaborative approach for many years between the Prison Service and the South Eastern Trust. And I think that's really enabled a decisive and collective response to this crisis, and also enabled at times those difficult conversations that have had to be had between the organisations. In our prisons, we aim to welcome people as they arrive in prison. And I feel it is that gift of welcome that is essential to the compassionate response during a pandemic. Thank you very much.
Thanks very much, Ruth. That was a fantastic presentation. And again, you've touched on a huge number of issues we could come back to in the Q&A. I mean, one of the many points you made is about the importance of going beyond the medical model in our response. And you commented that in the early days, the response to COVID was very medically oriented, and you quickly recognised the need for a much more holistic response. Yeah. And certainly I think that's something we could come back to in the Q&A as well. So with no further ado, I'll move on to our third speaker for this evening, Commissioner Peter Severin from Corrective Services New South Wales and ICPA. Peter, over to you.
Thank you very much, Stuart, and thanks in particular for inviting me to participate in this webinar, and obviously a very important issue that we're all dealing with at this point in time. So what I'll try to do is focus obviously on the global context as part of my role as president of ICPA, but obviously I can't do that in the absence of also talking about what we've done very practically here in New South Wales and in many ways across this country, and that also includes New Zealand. I might start with that because now we are sort of a little bit sort of the one that is a little bit out in the context of having been able to successfully keep COVID out of our prisons. So in New South Wales, we've got about 14,000 prisoners. That number has gone down by about 1,500 as a result of COVID and a whole range of factors that contributed to that. But we also have been able to essentially not have anybody infected, with the exception of one prisoner who transferred from another state, and he came into our custody being positive, and that has not resulted in any further infections. Why is that possible? I'm not suggesting we're doing anything that others aren't doing, but it was possible because, yes, we went in very early and quite decisively with some of the measures, and so Ruth has already alluded to some of the things that the Northern Ireland jurisdiction did that is not dissimilar to what we've done here in New South Wales. And when I say this, we are very fortunate. We've got a government that was very responsive. We were able to move legislation within about a week or two through Parliament that would have allowed me to discharge prisoners on parole. We were provided with resources that allowed us to very decisively go in. And I'm not just talking about testing, I'm talking about all the other measures that we have to take. We have specialist staff assigned to COVID particular focus in every of our locations. We've got about 40 prisons in this state. So a lot of effort has gone into making sure that without impacting too significantly, and I pick up on Trina's comment about the segregation factor, we haven't been in a position where we had to segregate. Yes, we quarantine, but we quarantine in a way that anybody that comes on the same day to the same prison can mix. They can mix, but not with people that come on the next day or the day before. They all get tested, and if you are positive or if you show symptoms that may give rise to the concern, yes, you will be isolated on your own, but only until the test results come back. So it's a quite flexible arrangement. ICPA is the global organization for prisons and corrections, and we do have genuine representation from all over the world. And what ICPA has done very early in the process is put all the resources together and really get the experts to facilitate dialogue across the globe. And what became very evident is that while we all deal with the same complexities, the response, and we're talking about the response being obviously the first stage in what I call a 3-stage process, being response, recovery, and reform. And I'll talk about the other two in a minute. It was essential that we shared resources, we shared ideas, we shared knowledge. None of us had ever experienced anything like this. And I welcome also Paul Gertz, who's on this call. I saw him in the participant list, who's part of our ICPA task force on COVID, and he facilitated the dialogue, particularly with Africa. Now that created dimensions that were completely different and in a different way complex to the situation we might have faced in Europe or in North America and so forth. So come some of the common themes, without going into all the operational detail, and now Ruth has already covered off on some things, is that we really need to ensure that we don't limit the management of our prisons more than we actually have to. And yes, there are very sensible ways of doing that, but it doesn't mean that we have to literally simply lock up everybody 22 hours a day. That's certainly my experience. I've been around this sort of game for a little while. You try to normalize as much as you possibly can. Communication was absolutely essential. And that's not just communication between prisons and the outside world. That was also communication between us as administrators with our staff in the first instance. So we have a consistent message, and the families and loved ones of prisoners. And Ruth was alluding to the video visits. Now, we did exactly the same that Northern Ireland has done. We facilitated 120,000 video visits so far. It's actually more than we facilitated in-person visits in the same time last year. And we did surveys and got the same feedback from visitors. And we are quite a distributed country, Australia, obviously, long distances to cover if you want to see your loved ones at times. So video visits are certainly something that have made a difference. Yes, we provided free phone calls. We got our telecommunications company to assist us with that. But in countries where that is not possible, it is so much more challenging to actually establish good communication. And you can't underestimate that. And again, through the dialogue at ICPA, what we've done is we pooled all the resources. They're all on our website, icpa.org. And this is really literally across the whole globe. All the resources, posters, communication materials, strategies, everything that is useful for jurisdictions to adopt, to simply copy, is there. And obviously there's a lot of stuff from Australia, from North America, from other countries. We had regular dial-ins with the commissioners and director generals from all over the world to just simply talk shop. And I think Tríona mentioned that one of the key advantages of having to face this is that we were able to collaborate so much more effectively, so fast. That's never been seen before. So I'll focus on the second area, and that is what might have been missing from the response, so what we could have done better. The issue was really, we were all snookered by the gravity of what we had to face. It was underestimated to be quite kind in the first instance, and we had to pull resources, ideas together very quickly. So a challenge to respond decisively in a timely manner was certainly something that was relevant for any jurisdictions. Many countries just simply have a lack of resources and focused government support. The prisons are often out of sight, out of mind, and while they're nicely tucked away behind walls, it's very difficult to engage with governments in the context of actually doing something very proactively. And I'm particularly focusing on developing countries here, Latin America and Africa. However, the pandemic has actually brought to the forefront some of the risks associated with having prisons being potentially hotspots of COVID, and that got the attention of politicians. And in many ways, that is something that was harnessed, but again, it could have been more effective. Stakeholder management, and I'm talking about stakeholders in broadest terms, the legal profession, families, professional visitors, anybody, has been quite inconsistent in many parts. And again, facilitating stakeholder engagement is something that is very important, and having a largely inward-looking philosophy to prisons. And unfortunately, that's just the culture of prison services now really forces you to think very hard about how you more effectively engage with stakeholders. Again, great examples are out there that we can all learn from. And the other one that it's a little bit of hindsight, but the pathway from response, recovery to reform were very difficult to establish, because we obviously then started with second waves, and we had to deal with a whole range of different dynamics where we thought we actually came off the back of it and came out really positive. And then again, it all sort of hit us again. 1 to 5 year horizon, I think really we all need to focus on how we have to manage recovery. We need to do that well. We heard about making sure that we capture the important opportunities, like decarceration was mentioned. I mean, in my jurisdiction, I have legislation that I can parole people. I haven't had to use that legislation, and we still had a decline in prisoner numbers. But we want to make sure that this legislation will expire at some stage, that we actually use this for criminal justice reform. We need to be predictable and consistent in the way we actually make decisions and communicate those decisions. The economic impact will not exclude criminal justice. Now, and this is just something that is in front of us. Our economies have suffered. They've taken hard hits, and criminal justice, being sort of often in prisons in particular at the end of the conveyor belt, will no doubt be under a lot of stress when it comes to resources. What I really think we have done very well, and again, Ruth mentioned it, we captured the opportunities of the smart use of technology. We have made changes to our criminal justice communication system, particularly with the courts, that we tried to effect for 10 or 15 years, and it happened in 4 days, and we should not lose that. So the other one that I think is really important is that we need to build a new normal, because we're not going to go back to where we were, but it needs to be done in a very inclusive way and with all relevant stakeholders, and of course based on what we know is evidence and what we know will work. I leave with one example. And this is a New South Wales example, I talked about tablets. We have very proactively promoted the virtues of our technology by using video visits, etc., etc. And the head of our government, the Premier of New South Wales, has given us now full endorsement to introduce in-cell technology into every space within our maximum medium security prisons, which is something that was just completely unthought of before. And it would have been more a matter of defending using this type of technology anyway, because we're not using it in schools, or we're not using it in other parts, and our very vigilant media would have really just killed it off at the pass. So having an opportunity to do this and get government endorsement, and I just think it's just a great story that came from the pandemic, but it's one that actually hopefully will create a much better space for us to move into. Thank you.
Thanks very much, Peter. Again, a fantastic presentation covering a lot of different issues that we could drill down into. I mean, one of the points that really resonated with me was this idea of response, recovery, and reform. And I liked your phrase of building a new normal and an evidence-informed better normal. And hopefully, if anything, that's a little bit of a silver lining on the COVID-19 pandemic and our response to it in closed settings. What I will do now is just hand over in a moment to Lindsay to facilitate a bit of a discussion. And just to remind everyone, the theme for today's webinar was about rights, accountability and standards. And so we've heard a little bit from each of our speakers about the importance of upholding the rights of people in custody, and particularly issues around mental health and visitation and being able to be in human contact with other people. There's also, of course, the issues around accountability, both in terms of the criminal justice system and accountability from a public health perspective, if we need to think about people transitioning from prison to the community while they're COVID-19 positive. And the importance of standards to inform that. And Ruth made some comments about changing standards and guidelines in the 5 nations and the importance of having WHO and PRI and others providing guidance. And Peter, again, has spoken a little bit about the ICPA resources to provide some of that guidance. So I think there are so many issues we could explore here in the time that we have left. But I'll hand over now to Lindsay to see if she can pull a few of those issues out in conversation with our panellists.
Well, it looks like I've got my work cut out for me. I'd just like to remind participants, please enter your questions into the Q&A and I'll make sure we get to it, as it looks like we've got quite a bit of time. So I just want to start off with the fact that I think this is a really interesting topic for our webinar series, because it brings up a lot of tensions between competing rights that are really nuanced and really difficult to navigate at a local level, but also at a more broad scale. And really there's no satisfactory answer when it comes to a lot of these things. So on one hand, there's the right to maximize liberty within prison settings, and that's really so intrinsically tied to well-being, such as the right to maintain family relationships and the right to have access to outdoor time and recreation, which I think all 3 of you kind of touched upon. But on the other hand, there's a right to be protected from COVID-19 in the face of an immediate health threat and maximize the chances of remaining illness-free. So maybe I'll actually direct this one to Peter, given that he's kind of been in roles where he's been managing prison environments. How can we reconcile the competing needs and human rights when we consider that people in custody have different needs? So decisions that we make to respond to COVID might disproportionately impact some people in custody over others. So for example, allowing in-person visitors might be protective for somebody that has severe mental health concerns, but it also might put someone else at harm who has comorbidities that make them more susceptible to harm or death from COVID-19. So how do we make these decisions, and what is needed in order to support this at a local level, but potentially more into, we spoke about reform and at a larger scale in the prison system itself. So it's a bit of a big question, but hopefully Peter can
right. I mean, I think, Lindsay, you pointed out, we also have an obligation to ensure the health of prisoners. We cannot have a system that exposes prisoners unduly to the risk of infection. So what we've done, and again, I use that as an example, and we're very privileged, and I can't sort of say this can be done anywhere else easily, particularly not in developing countries. So we very early engaged with the tertiary sector and got the Kirby Institute, which is part of University of New South Wales, to do some modelling for us. We've done that earlier years ago with the Hep C matters that sort of were hitting the prisons hard. So the Kirby Institute did some excellent work. So it was evidence-based for us to say, if we do these, if we basically eliminate these opportunities for the virus to spread, if we have a positive case, we can actually reduce the prevalence of it by X% or Y% or numbers or whatever. And we can literally plot that over every prison. based on the vulnerability of the prisoner cohort there, etc. So what we've tried to do is base all of our decisions on real evidence rather than simply just sort of jumping at some quick conclusions. We took very careful note, of course, of our health professionals and the Ministry of Health in New South Wales, and we can't ignore that. But in doing so, we tried to balance the need for normality with the need for safe custody. And I'm not suggesting that we did everything exceptionally well. We didn't, but I used it as a general comment. So wherever we are, we should try to base our decisions on evidence, but also, of course, balance it against the unequivocal requirement to keep people safe.
Thanks, Peter. Tríona or Ruth, do you have anything to add to that?
Peter, I would love to see more about that modelling. I think that's absolutely amazing, and I think that's the robust approach we need to take, because this is a serious issue. It's a very, very complex issue of how you keep closed populations safe, but the complexity around the mental health impact, the well-being, there's a balance to be made there. For us in Northern Ireland, we didn't have the modelling specifically, and we had to rely on the guidance that was given, but I think it was very clear, very robust guidance that people have worked really hard on. But I do think that the learning from what you're doing is incredible, and that's where we need to go.
If I can just make one comment. It's open source. I made it available on the ICPA website. You can literally go into icpa.org. Under the COVID section, you'll find the model. You can download it. It's very simple. You can plot your prisons against it, and then you can do what-if scenarios. That's for everybody, obviously, not just for Ruth.
I'd also just add on that I think that's a clear difficulty we've found globally with sort of blanket ban restrictions and things just being applied in a very sort of blanket way. Ideally, where it's possible, I mean, we would need things to be guided more by the real and current risk and based on evidence, as Peter said. But in order for places of detention to do that and to allow, say, some visitation or some access to prisons, whether it's for family or support services, in a lot of countries, it's local NGOs that are providing most of the sort of support or rehabilitation programs in prisons. So by cutting off all of that contact, we need to be able to allow access, at least even for monitoring bodies in places of detention during this time where people detained are at a real significant risk. But to do that, we have to have access to all of the relevant equipment, PPE, availability of testing, so that can be done in a safe way. And in so many places, that just hasn't been possible, where prisons just aren't able to provide the absolute basics, not to mind, now the additional equipment needed. So one thing we've noted is where the responsibility for healthcare in prisons sits with the Ministry of Health. In some countries, the coordination on that sort of equipment and provision of PPE and testing has been easier. For example, in Italy, rather than where prison health is the responsibility of the Justice Ministry or the equivalent.
Thanks for that. And just to the participants, I will also note that you're able to type questions into the Q&A instead of speaking them. So if you can enter them there, that would be great. And thanks to those who provided questions. We've got a question from an attendee here, just in response to that. They said, when we consider these challenges of balancing rights, who provides or should provide oversight when these decisions about competing risks are being made?
I mean, I have a very simple answer to that. It might be very crude, but fundamentally under the law, I hold all the responsibility for it. But oversight is important. And we have an inspectorate, obviously, in our country here, or in our state. The inspector fully endorses what we're doing from a human rights perspective. And there was a question I saw, how do we do inspections right now? Actually, our inspector here in New South Wales is doing virtual inspections. So we basically have, they physically now back, but when they couldn't go in, they just interviewed inmates or prisoners via Zoom. They did ask staff to walk around with cameras to physically see parts of the prison that they wanted to have a look at. So anyway, it was not the ideal, but it basically meant that our inspection regime never stopped.
Yeah, I think that's crucial, and we have all had to innovate during this time, and I think for the inspectorates, they need to do that as well. So I think to go virtual is really important, because I think there has been a delay for many places around that accountability, and it's really important that it's maintained, especially at a time of real crisis where people are struggling, where staff are struggling, where the pressures of quarantine or isolation or restricted movements really need to be investigated, and we do need accountability. We sit in Northern Ireland, where healthcare and prison are separate, and that brings an accountability, I think, to both organisations. And we've collaborated, and the difficult questions have to be asked. Are our services providing the care? What are the issues with restriction? And we need our external bodies to hold us to account as well.
I'll just add, perhaps for all of the panellists, one model I'm aware of in the jurisdiction we are actually in Victoria is to have an independent ethics advisory group. And Peter, you commented that in New South Wales, for example, the decision ultimately rests with you. But one model that's being explored here is to have a group of independent individuals to provide advice from an ethical perspective on particular instances in managing that balance that Lindsay's alluded to, between, on the one hand, the importance of the rights of the individual, on the other hand, particularly with respect to a communicable disease, the potential risk of infringing on the rights of everybody else in that setting.
Yeah, we don't have a generic ethical advisory group, and I don't think we'll go down that path at this point in time. We do have advisory groups that are very specific for Aboriginal Torres Strait Islander people, for example, for women, and for other sort of cohorts of offenders. We have official visitors, as most jurisdictions do in the developed countries, and obviously the inspectorate. Plus the Ombudsman plays a big role in our context. Interesting, just focusing on the inspector. The inspector's focus actually in recent communication I had was more about us continuing to be very COVID safe in the way we actually manage our facilities, and sort of her concern is that there will be a bit of COVID fatigue creeping in, where now the staff will start not following the rules as much as they used to. Our staff are required to wear face masks when they have any direct contact with prisoners. That's a result of a health directive. So we are just really focusing on rejuvenating communication and making sure that we keep this up. And again, it's something that I certainly would recommend anybody else to do as well. There's no substitute for it. And in a prison environment, you don't use technology like this. You have to have face-to-face direct approaches with your staff when you do the morning parades or whatever type of direct address happens. And it's the leadership that plays a big role, but it's also continuing the focus on it. One other little aspect that I just wanted to mention is that we have engaged prisoners very proactively in cleaning regimes. Sounds trivial, but because we lost quite a bit of industry opportunity as a result of manufacturing simply not being able to be done as much as we normally do as a result of the economic consequences, we really put cleaning on steroids almost. But we also do it in a way that prisoners can actually get a certificate in forensic cleaning. So that's a very tangible job in the future, I guess. Forensic cleaning will be with us for a long time. And so we combined the need to be clean, and we've got I think the most forensically clean prisons that I've ever experienced in my career. but also give a bit of a vocational training benefit for inmates to take out when they get back into the community.
I wanted to just quickly pick up on a point Peter made around COVID fatigue, because I think Ruth also mentioned earlier, I think you said it was almost burnout before we'd begun. And I think that's really important to note for staff and everyone. I mean, even for everyone in the community, you know, this has been a really stressful and difficult time. And so for people working in the sector, it is really, I mean, in some countries we've seen even where prisons have gone into lockdown and the staff are locked down on the grounds as well, you know, so people haven't seen their families for weeks or a month. And so I think that's really important to keep in mind when we talk about the impact on mental health. It's not just the people detained, but also people working.
I agree with that. I think there's a really heavy burden on prison staff as they come in. If you have a prison population that is COVID-free, the people who are coming in, the healthcare, the landing officers, you know, we're the potential carriers. And I think that's a really heavy burden that needs to be really investigated, and how people can be supported. In Northern Ireland and in many jurisdictions, there's contact tracing for staff, which is absolutely brilliant, but we need a no blame culture around that, because the complexity of coming into work, of discerning, have you got you know, a cough, a sneeze, a cold, asymptomatic, you know, the disease trajectory is still so complex and unknown. And I think we are going to see that there's going to be an aftermath for our staff. And they've already had 5-6 months of high tension, working on their landings, providing healthcare, going home to, you know, altered situations of high tension as well. And I think we really need to consider, how are we supporting the frontline staff, both prison, healthcare, and other agencies that are in our prisons, what we can do to support them.
Thanks for your comments. Those are all very interesting. And I just wanted to touch on one more thing before moving on to some other questions that we've got. There's been a few questions about data. And not only is data critical for really quantifying and assessing the risk, but also just understanding what's happening in our prison systems. And it came up a few times that there's really often many places there's not widespread testing to even know how many people are infected. So I'm just wondering, what role does data collection play in terms of accountability, and what kind of partnerships, or how can we ensure that happens in places where it's not happening, and what's it going to take to have the good data to make decisions that are proportionate to the risk experienced in correction settings during COVID?
I might start, if that's all right. I think data collection and use is absolutely critical. I mean, I mentioned our modelling. We are doing a lot more, which won't be information that, or won't be systems that we can make available because they're very sort of sophisticated and expensive, but it really takes it down to the last level of detail in the person, their whole medical history and so on, and the vulnerability that they're subject to, in order for us to be able to organise placements, etc., etc. But it's also about data relating to what used to be our business as usual, and now we all suspended business as usual in many ways, but we still have to manage the objectives of our system, be it in terms of safety and security, or rehabilitation and reducing recidivism. So for me, it's a combination of sophisticating our standard data collection body, but also adding to it the opportunities that we now have by working a lot closer with other parts of criminal justice, for example, the police, the courts, and there's some, I mean, again, it's maybe something that is not unique, but very much in focus in our state. It's a digital rejuvenation that we have now been invited to put bids in and identify opportunities to sophisticate data collection, data usage, to inform the way we do business now, but also, most importantly, to fundamentally cement some of the reforms. And I'll use one example. It's not topic here tonight, but we will completely changed the way we manage people who are under supervision in the community. We also look after probation and parole here, my system, and that's the direct result of some of the needs that we had to meet under the COVID restrictions, but also the data informs us that we're actually achieving already better outcomes in engagement and I'm talking about engagement with offenders than we did in the traditional way where you make offenders come to the office and sit down, have a chat. Using FaceTime, using other ways of communicating actually already indicates better outcomes. I wouldn't go as far as saying outcomes, but certainly better engagement.
Ruth or Tríona, do you have anything to add to that before we move on?
Yeah, I couldn't unmute there. I was having trouble. I think, that is key. Looking at the changes during COVID in the prison population, or in the prisons, but also across the Health and Social Care Trust that I've been involved with, the learning framework, we still don't have that critical skill of interrogating data, of understanding what the data is able to reveal. A lot of the data that we collect is process data, it's numbers, it's widgets. We have very little understanding or mechanisms to look at impact and outcomes, and Peter just alluded to that. So I think we've really got to reflect on our systems. We have, within a prison service, you've got so much data, but are we actually reflecting, understanding, upskilling, getting analytical data, experts to support us so that we can understand our responses? For us in Northern Ireland, one of the big things was, qualitative data on people's experience. We need to know what it feels like to be in prison, what really matters, and then not just listen to that, but actually respond to that. And that's where we have tried to take that data and use that thematic analysis to run it over time, to see if, as we hear more and more stories, so for example, around the engagement, initially our first month or two when people were entering prison or isolation, they were saying, we don't know how to access anything. We don't know anything about anything. It's really complicated. And we were hearing this story time and time again. And then we introduced an engagement officer who the prison service enabled to go onto the isolation wing. That was real collaboration for them, who was then able to do that face-to-face with social distancing, with PPE, mitigating for risks, but bringing that human contact back into the encounter that had been reported through our interviews as missing. But we have to hold ourselves to account. We have to keep monitoring that. It's a rolling survey, because we don't want just cross-sectional stuff. We actually want to see, are we making an improvement? Are we accountable? Can we actually support the people? And so I think we've got to be smart with data. I think we need people within our teams who have a responsibility towards data, and then help and empower and shape the rest of our teams to understand it. And then obviously the reporting mechanisms back to our agencies are really important as well.
Just on what Ruth mentioned, I would just add that the importance of disaggregated data as well, particularly around something like COVID. It's important to have information on age, gender, ethnicity, and that will help, I think, in the sort of analysis you were talking about, and on impact and outcomes, and shaping sort of, our responses in the future, and policy around this. I think there was a question around what to do if the information isn't forthcoming, and one solution could be around sort of, parliaments and investigative bodies can request this sort of information in their sort of oversight of how governments are responding to the pandemic. So that could be one option where, where the information hasn't been made available yet.
Thanks, everyone. I think, it's really nice to hear, Ruth, you bringing up more about engaging with people's lived experiences you did in your presentation. I think it's often something that we forget about, but if we're especially speaking about human rights, we really need to get those stories, because we won't get any of this information from big data, and it's so critical to people's experiences. I just wanted to switch gears, because there have been a few questions about lockdown and extended isolation as this being one of the more immediate measures that's been taking place, and for what meant to be a temporary measure, it seems now to be more an extended measure that's really impacting people's lives and is just simply awful. So there's a question from participant that says, it's directed to you, Tríona. You noted that in many countries, mitigation of COVID spread has been achieved through what has been effectively solitary confinement for months at a time. How will prisons in these situations move towards less restrictive measures with the threat of a second wave of infections and presumably third or fourth or fifth waves?
Yeah, I think that's a really important question. Well, I think, firstly, it's been incredibly frustrating. I can't even imagine the frustration for people in these situations where you see things start to open up in the community, people being able to move around more, and you're still in a very extreme sort of lockdown setting. So I think we have to focus our attention on that and put the resources that are required into freeing up those situations. So the responses, I think, need to be very much led by the healthcare responses, based on, as Peter was saying, evidence-based sort of clinical guidelines, and really what will allow prisons to release some of those restrictions will be having the resources they need and the equipment they need to allow movement within facilities and allow movement of people in and out of facilities in a safe way, where people are protected in terms of the physical health risks. So I think it's about prioritizing them in terms of sort of financial and practical resources.
I think this has got me thinking a little bit about long-term reform, and with these immediate measures taking place, what about how do things proceed from here in terms of we're going from immediate measures to this bigger concept of reform in general? Just some comments about that.
For me, one of the big issues, I think the biggest issue is legislative reform around sentencing and the prison population. And I think we need advocacy. We need really strong advocacy. And again, I go back to evidence-based. What's in it for society? How can society benefit if we change our system? And I think we've got to learn the language of to win people over, to understand. And for me, as I focus maybe on exiting of prison as a big reform, rates of recidivism, how much does that cost the economy? How much does that, and I just don't mean financial cost. Financial cost is a massive thing, but I mean emotional and the burden of communities and society. And I think we have to, again, go back to being smart, evidencing, being comprehensive as we plan services, as we pilot things, as we work collaboratively across jurisdictions, as we work with other agencies and organisations, and really to up our game around what is possible. And that, I said dream big. I think we do have to dream big. Things can be different, but we've got to really put the effort in and be robust and have rigour and understand that if we change our structures and our systems, what are those outcomes going to be? What's the benefit going to be for me? Firstly, for those who are incarcerated and for their families, but I think there's wider implications for society, and we've got to, and that's where I think the big collaborations come together, where the organisations that these guys are involved in, where your academic rigour is absolutely crucial, that we work together and we collaborate and we become a really passionate but professional voice around reform.
I just want to comment on something about that. It seems like there's a lot of focus on post-release and exiting people early from prison, but there's a question here about pre-trial detention. And the question is that the presentations have focused on the rights of people in detention, the mental health and treatment, but crucial point is also the right to personal liberty and how this right is protected during the public health crisis. People who are in pre-trial detention, for example, even before the pandemic, The extensive use of pretrial detention was a major challenge globally. What have you seen in your jurisdictions during the pandemic, and how is the revision of pretrial detention, access to courts, and legal assistance taken place to help support this reform?
I might make a comment to that. It's actually a very good question, but it's also a great opportunity following on from what Ruth was just saying. So we've experienced a significant drop in people being remanded in custody, so being put on pretrial detention when the pandemic started. So what I've asked almost sort of within the first few weeks was to start some research on following these people who didn't get in, that normally would have got in to custody, and see what the normal sort of course of events is in relation to their reoffending. So we obviously have control groups of those that didn't end up not getting remanded in custody. So if we can demonstrate that the reduction of using pretrial detention has actually had a positive impact on reoffending, we've got a most compelling argument to make. And it is just literally just on our doorstep. It was just like a little present put on our foot mats. But we need to harness it straight away. So this is work that's already started in my jurisdiction. And obviously it'll take a couple of years for that to become a very firm and robust data, and hopefully it will stack up. I mean, it'll be interesting to just follow it. But if we assume that now the use of pretrial detention is overused or is too high, then in all likelihood it should actually present some positive outcomes. So I think, and again, I've made the point before, for any of our criminal justice reforms, be it decarceration, be it sentencing reform, be it pretrial detention mitigation, we can use the COVID experience as a lever. It won't in its own right stack up, because people will, once this is over, if it ever is over, but let's assume for 1 second it will be, inertia is a very strong factor, and particularly when it comes to criminal justice. So we need to actually, without sort of overstating it, be very smart and strategic about how we let the COVID experience influence and guide the way we actually commission research, create the evidence, and then move some criminal justice reform forward. There will be great appetite for that because there won't be much money around. So if there's any opportunity to do something smart now, it's now.
I was just going to ask, is that methodology on your website as well, Peter?
No, it's not on the ICPA website, but I'm very happy to share it. Obviously, my research team would be the one that you have to talk to. Yeah.
Brilliant. Thank you.
So, believe it or not, we're about 15 minutes to 8, well, actually, our local time, 8 p.m., so different for everybody else. So I just wanted to touch on something, and it's come up in a few of the questions in different aspects about communication. And Peter, this is something that you spoke about in regards to communicating to staff and communicating between health authorities and sectors. What is the role of communication with regards to implementing measures that reduce or limit freedoms, and how should we be communicating to people in custody and to staff in order to make sure that the rationale and their, the reasons behind them are explained clearly so that people kind of understand what's happening and why?
It's a very, very good question. And if she could, I would ask her to talk about it, because I just saw Mary Britton, my strategic communications advisor, is on this call as well. Mary works directly in my office, and I quite intentionally asked her, not only because she's brilliant what she's doing, but because it comes from the top, to coordinate the communication together with our central command post here in New South Wales. We need to we cannot underestimate the importance of having very succinct but also very multifaceted communication at all levels. It's the personal level for staff, it's the stakeholders, anybody that has anything to do with us, it is obviously most importantly inmates. So we have a whole pack of communication materials that we give people who are incarcerated, and that includes things like even sort of things to keep yourself occupied in a meaningful way while you are in quarantine, or if you have to be in isolation. So it's not just simply being there, and we do it culturally responsive in our country. Obviously, we have a very high number of Aboriginal Torres Strait Islander people incarcerated, and that adds some other dimensions to it. So from the verbal communication to every staff member to consistent messaging, and that's the most important aspect of it. We have to have consistent messaging. They have to have literally one voice. So all of our communication, and I say this only because I've experienced it as being effective, goes through a single source of truth. So that prevents anybody from making up their own stories or not adding any of their own little connotations to it. And we obviously need to check in. You know, in corrections, it's not what you expect, it's what you inspect that makes a difference. So therefore, for us, it's also about having that feedback loop, making sure it happens. So again, it's multifaceted. We do little videos. We do a lot of social media for visitors, for external stakeholders, a lot of Facebook, Twitter, LinkedIn, depending on the audience. And we get enormous response. Like, we are now the second most hit web Facebook site in the state government. I think it's only health or police, one of the two, that outsmarts us since COVID. Now, because they're important messages that go out, and things that families access. And so, again, a lot of that stuff you can find on our website, ICPA website, and it's a great source of information.
I'll just add there has been a comment that the ICRC developed some very good animations on COVID and communication with inmates, staff, and visitors for anybody who's interested in checking that out. So thanks for that comment. And just very related to this, and I think we've got a little bit of time here, just a couple more minutes if one of you wants to take this one on. Mindful of COVID restrictions, what are the practical ways that families can reduce stress, and how have other countries increased or optimized the contribution of families? And I just picked this one out last because I think it is quite related to the communication to staff and to inmates, but families being such an important part of this picture, and preserving those family ties, especially during a time of uncertainty, is really critical. So just any comments on how we can engage with families to ensure that they're also maintaining their well-being and their rights are being respected to connect with their family members and their loved ones that are in custody.
I just want to start this one off referring back to ICRC, and one of their pillars of aid is information, and they say it's as important as shelter and food. And I think we really need to be very clear, as Peter was saying, about our communication. And it's not how we develop our communication that we think is transferring information. We need to really understand the receiver and how we do it, and how we design. And if it's peer-led, it's obviously very often more effective. I think the connection with families is vital, and I have to say that it's something that we are still working on. So there's been, I think, the virtual visits has been really significant, and there has been, Peter mentioned it, you know, people can come, people with families, the distance isn't an issue anymore if you're virtual. And so I think families have been supported in that way. But for me, that's a really good question. It's a really big ask, and it's not just around COVID. It's around how do we, as I hope we move towards a community development approach to our prison community, that has to involve those networks with families. And so I'll be really delighted if through this series of webinars, you know, that's investigated further and best practices shared by other people.
I'll just add to that I mean, in some countries, you know, people in detention are entirely reliant on family members bringing them essentials, you know, even food, medicines or medical supplies. So I think there's the impact, you know, in that respect as well, not to mind on the families and the stress and anxiety caused by the lack of contact.
Thanks for that. I just wanted to add that there was another comment that it was not ICRC, but the CDNA, which is the Communicable Diseases Network of Australia. So if you search them plus communication materials, then that you should find that. So thanks for clarifying.
I should apologise. That was an ICRC seminar that discussed it.
That makes sense. Got a number of questions left. Unfortunately, we tried to get through as many as we can. But I think I'm going to pass it off to Stuart to kind of wrap things up. But perhaps for those who didn't have their questions answered, I could suggest, and of course, Ruth, Tríona, and Peter, feel free to say you're not comfortable with this, but if we have, you have their emails, I think they were on the slides, I'm sure that they would be happy to answer any burning questions that you have about what they spoke about. So thank you so much for your contributions, to everybody and to the participants for your questions.
Thanks, Lindsay. We have about 6 minutes left before this Zoom will automatically close itself, so I'll be very, very brief. As Louise alluded to at the beginning, we've covered a lot of ground tonight, and I think we could have kept going for a lot longer if people could stand being on Zoom for any longer. But we're very, very grateful for the discussion. There are 6 key issues that I've taken away from this. The first is, again, reiterating this idea that the COVID pandemic has been a bit of a pressure test on many systems, including the prison system and the interaction between the prison system and other systems in our communities. The second is the importance of human contact to well-being and mental health, and the importance of doing everything we can to maximise that, including contact with peers, including contact with families as well, obviously, as with staff. The idea of trying to be as least restrictive as possible, to not implement restrictive responses to COVID any more than we absolutely have to, and the importance of ensuring inspections to make sure that that is indeed what we are doing. As a researcher, I was thrilled to hear everybody talk about the importance of data, both qualitative data, as Ruth was alluding to, and quantitative epidemiological data, and sharing those data to inform our responses. That doesn't give us a get-out-of-jail-free card, excuse the pun, for some of the values-based decisions in managing the tensions between rights and accountability, but it certainly helps us make informed decisions. Peter, I think, alluded to the importance, and so did Tríona, that some of the things that we have been able to do in high-income settings are not as easy to achieve in low and middle income settings, and so it's always really important that we think about how to respond in a way that's achievable without the resources that we're lucky enough to have in some of the higher income settings. And lastly, this idea of building a new normal, I think, is a really nice note to end on, and Peter again alluded to the importance of seizing the inertia that we currently have, trying to build on that to create some of the reforms that the evidence now suggests may be achievable. What I want to do now is invite each of our panellists to, in probably about 30 seconds each, if you have any last burning thought, observation, comment about the discussion tonight, to please just share that with us now. And I'll go in the order that we did our presentations. So Tríona, just starting with you.
Thanks, Stuart. Well, yeah, thanks for all the discussions today, this morning for me. So I found it really useful. I think the note I'd like to end on is just that people in detention are so often forgotten or ignored, and this pandemic is far from over. Its knock-on effects, particularly in terms of mental health, as we discussed, will be huge for everyone, including in the community. And for people in detention, the interim measures and the emergency responses we've spoken about, you know, they won't be enough, and we need bold and systemic reform to mitigate the devastating and long-lasting effects on health and well-being. So as Ruth said earlier, prison health is public health and just must be prioritised during a public health crisis.
Thanks, Tríona. A fantastic point to end on. Ruth, any last comments?
Yeah, just very briefly, I think we've been focusing on rights and accountability, and I think we must have a value-based, person-centred approach for COVID and for how we provide health and social care and support in prisons. And I think we need to really be bold in how we approach this.
Terrific. Thanks very much, Ruth. And finally, Peter, any final comments?
Thank you. Yes, prison administrator, obviously, I would like to think that our critical friends will be constructive friends, particularly those from a human rights perspective. This is something that is a challenge for all of us, regardless of where we are, in the best equipped countries or in the most undeveloped countries. And we need, obviously, our critical friends to be there, but they need to be constructive. And just to highlight one real life example, my colleague who's the head of the Florida prison system and his deputy went into one of their facilities and they both got infected as a result of visiting one of their prisons. They're both fine, they're all good, but now this is nothing to do with being behind bars or in front of bars. It is a relevant issue for all of us. And if we can maximize the way we work together and harness the opportunities in a positive way, the better it will be as an outcome for the inmate population.
Great. Thanks, Peter. That's a nice note to end on as well. And so in our last minute, I want to again just thank our three fantastic panellists for generously donating their time. I think this has been a fascinating discussion. This is being recorded. A link to it will be made available on the Justice Health Unit website in the next week or so. We'll tweet that link out as well. And so I'd encourage anybody who is interested in or who wants to share that with other colleagues who couldn't make it to the webinar to please share that link. We'd be very keen to hear your thoughts on any of the conversations that were had tonight. And then moving forward, as I said before, this is the third in a series of 6 webinars that Louise Sutherland has collated for us. The next 3 webinars, as you can see here, next month, we have a webinar talking about immigration detention and COVID-19. Certainly some similarities with the issues we've discussed tonight, but also some very important differences. In November, we're going to be having a conversation about Australasian issues. Peter, we hope that you or some of your colleagues might join that as well. Perhaps we'll have to come back to you on that. And then in December, wrapping the series up, we're going to talk about international responses, thinking broadly, next steps for policy, for advocacy, for funding and for research. So anyone who's joining us tonight, we would welcome your time again at the next 3 webinars. The links to those and the times we made available on the Justice Health Unit website and on Twitter in the near future. And with that, right on time, I want to thank everybody for their time tonight and wish you all well and stay safe until next time.
Thank you.
Thanks very much.